Good morning, good afternoon, everyone. I'm very pleased you could join us today. I am Marion Steff and I work for the European Disability Forum. We are a regional organization of persons with disability, meaning a DPO, and we are based in Belgium. So I'm here today with my colleagues Rachel, Loredana, and Lucia, and they're going to be supporting the logistic of this webinar. The seminar is organized by EDF and is the first one of a series related to the Innovation to Inclusion program. So it's a new program and we call it i2i. So I won't tell you much more about it because we're going to have wonderful speakers talking about our work into more details. In any case, it is important to mention that this series of webinar is funded by the UK Department for International Development, so DFID. We are delighted to have 85 people registered to this webinar. It's also accessible with captioning provided. So the link of the captioning is in the chat box. We also have Lisa today, who's going to be doing the international sign interpretation. And the webinar will be recorded and later accessible on EDF website. So I'm very delighted to welcome three speakers. Our first speaker is Mrs. Sakunthala Mapa. Sorry, Saku, I say your name wrong, Sakunthala Mapa. And that's why I call you Saku, if that's okay. And then we're going to have Dr. Morgan Banks and Mr. Albert Mollah. So I will introduce the two other speakers a bit later when they will be speaking. Because right now we're going to have Saku for speaking for 8 to 10 minutes, and it will be followed by questions from the audience. If you have any question, please write them in the chat box. And yes, I think that's all I need to tell you for now related to logistic. So Saku is the head of the Innovation to Inclusion Consortium. She's originally from Sri Lanka and is now based in the UK with Leonard, Cheshire. She started a career working with the World Health Organization, focusing on public health, and later she moved on to leading multi-country projects across Africa and Asia. She's also a trustee on a social enterprise that focuses on youth development and education. So today, Saku will talk about the Innovation to Inclusion project. She will provide an overview of what is the program, what we would like to achieve, and who we are working with. Saku, the floor is yours.
Thank you, Marion. Thank you very much for the introduction. And it's perfectly fine to call me Saku. The name is a little bit long, but for those from Asia, it's quite a common name. So you could call me Saku or Sakunthala. And thank you to EDF for organizing this important series of webinars. So today is, I just wanted to present a very short overview of the program. Or the project, because there will be many other webinars where we will go into the details. So like Marion said, Innovation to Inclusion, or some of us might know it as i2i, it's a 4-year project that's focused on inclusive employment and funded by the UK Department for International Development. The i2i project is led by Leonard, Cheshire. It's a consortium and delivered by a consortium of diverse and complementary partners. I will go into the details a bit later. The program will be implemented in Kenya and Bangladesh during the first 2 years. And then in the 3rd year of implementation, we aim to expand it to a 3rd country to validate the successful interventions from the other 2 countries. So what does the project want to achieve? The project is designed to contribute to ending global poverty by 2030. That's how we want to contribute towards the global sector. But we know that disability and poverty are linked in a causal and consequential relationship. People with disabilities often experience considerably higher rates of socioeconomic disadvantages than people without disabilities, and that includes lower rates of employment. So that was the main aim when we designed the project, or that's what we kept in our minds. And the project will deliver a series of innovative solutions which are designed to be holistic and people-centered, that will result in direct and sustainable change for women and men with disabilities. So what do these interventions look like? So at an individual level, that's for women and men with disabilities, the i2i project will work to ensure that people with disabilities have access to skills development, in particular relating to digital skills and soft skills training, because we believe that will increase their ability to access waged employment or join the job market. So we look at technological solutions where appropriate, and those will be used to ensure the employment pathway that we want to develop and test for women and men with disabilities is inclusive and supportive. The program will also conduct pilot interventions to test transformative approaches, that's to address specific challenges that women with disabilities will encounter in entering the waged employment market. At a private sector, because the program is focused on creating waged employment opportunities, particularly in the private sector. So the program will work with private sector or employers to review and implement inclusive company policies for women and men with disabilities. The program will work to increase the number of job opportunities and apprenticeships offered by the private companies. And will also strengthen, currently in Bangladesh, there's a business and disability network, which we will work very closely to strengthen. And in Kenya, we look at the possibilities of establishing such a platform. So this twin track approach, where we will have interventions towards individuals and private sector, will also be supported by inclusive policies and systems. National statistics officers are going to be supported in terms of strengthening their capacity to use Washington Group questions to ensure that there's high quality comparable disability data. Because we know that having improved data collection systems and comparable data will support governments to monitor policies and legislation. And that's also a very important intervention where the disabled people's organizations will play a significant role to hold governments and other stakeholders accountable to the global commitments through evidence-based advocacy through this project. So how will the project be implemented? The program is designed on the premise that the gap between demand and supply for employment can be bridged only if we intervene at different levels. So like I mentioned earlier, at the individual level, at the labor market, and at the policy level. But we want to intervene at this level simultaneously, and we want to look at use available technology solutions to take them from currently being challenges into opportunities for people with disability. The innovative use of technological solutions underpin a large proportion of the interventions that this project will develop, test, and validate during the next 3 years. During the last 8 months, we've done quite a lot of studies in the countries to understand the context in terms of being able to try some of these innovations. And today you will hear a little bit from one of the colleagues, or one of the consortium partners, the London School of Hygiene and Tropical Medicine, about the studies that they had done relating to policy environment. But in the next couple of series of webinars, we will also introduce some of the other studies we've done relating to the labor market, the market scans, the availability of assistive technology, and also like review of the data systems currently in country looking at social protection. So just to summarize, the intended outcome of the i2i program is increased economic empowerment and well-being of women and men with disabilities through an enabling gender transformative environment and technology supported solutions to enter the waged employment in the private sector. So finally, just wanted to also let everyone know that this is, like I mentioned earlier, it is a consortium that's delivering this program. And that's one of the reasons why we can be this ambitious, hugely ambitious in terms of reaching 10,000 persons with disability, working with the private sector, working at the national policy level. It's because we have a wide range of consortium partners who bring quite a lot of different expertise into this. So we have the consortiums led by Leonard, Cheshire, but we have World Bank, the International Labour Organization, the London School of Hygiene and Tropical Medicine, the European Disability Forum, CBM, Global Disability and Innovation Hub, Plan International at a global level. And we also have Action Network for Disabled in Kenya, that's ANDI, and the Bangladesh Business and Disability Network as the core consortium partners. But these partners, or this program, will also engage with local actors and stakeholders who are also critically important. And that would be the disabled people's organizations, the technical and vocational education institutes, technology and software companies, in both countries. So later on, you will also hear from one of our key implementing partners in Bangladesh, Access Bangladesh Foundation. So that was just an overview in terms of what the project is focused on in terms of inclusive employment, how we propose to develop and test some of the innovations we want to bring to bridge the gap between demand and supply, and who would be in this journey in terms of implementing the program. So I will stop there, Marion.
Thanks, Saku. That's really, really clear. So, so I just want to say to everybody that you are muted. But if you have any question, you can write them in the question section of the chat box, or you can also raise your hand and I will unmute you. So, Saku, I've got the first question for you, which is related to the activities. So what are the first upcoming activities that we should look out for in the coming month?
Coming months, I'm assuming that meant months, right? Not month, Marion.
Month, yeah.
Yes. So if you look at up to the end of this year, because we were originally going to start the program, the implementation phase in April, but there were some delays in signing the contract. So realistically, we were able to start only the project in August, giving time for contractual sort of signatures between the partners. So at the moment, let me sort of highlight three sort of key things that would be happening. One is we want to take the market scan that we've done in Kenya and Bangladesh, identifying private sectors to the next level in terms of developing a private sector engagement strategy. So going more details in terms of agreeing with some of the companies that we have already engaged with in terms of what types of jobs are available, when they would be available, and validating our project, the model. Then the other key sort of area that we've currently been working on, and which you will also hear us working more closely, is around talking with software companies and technology companies in both countries to be able to understand what existing platforms are currently available and how could we work with them to make them inclusive and accessible. Because the project is not designed, or we are not aiming to create new things in countries, because we do need to make sure that we are making existing platforms adaptable and inclusive. Then in terms of at a national level, we also have colleagues from our ILO office who are identifying people both from the national the statistics officers in terms of understanding who should be trained for the use of Washington Group questions. So in Bangladesh, we are engaging more around the labor force surveys, where we want to introduce a disability module. And in Kenya, we're trying to identify people and work with them to organize capacity building sessions. to be able to analyze the Kenya census. And on top of that, we will also be putting together a tool that's been designed by OHCHR to sort of like, help DPOs to build their capacity around evidence-based advocacy. So to be able to look at CRPD Article 27 and 28 and understand the compliance in both of the countries. So these are different sort of things happening at the same time, but you will definitely be hearing from the country consortium partners or from us around this.
Okay, Saku, thank you. And then we've got a question from Nathan Rowe. I will ask you what steps are you taking to reach, what step are you taking to ensure the program reaches the most marginalized group of persons with disabilities, such as people with intellectual disability, psychosocial disability, and deaf blindness?
Thank you for that question. So when the program was designed, we were conscious that, when we looked at some of the data, that there are different types of people with different types of impairment who may be left behind in the employment sector more than others. So we have designed 3 pilots to basically understand what interventions work and how can we take that learning to use it in the other countries. So we have identified small pilots. One is looking at women with disability, because when we looked at compared statistics in terms of waged employment, they had a huge disproportion figure in terms of joining the labor market. Then we are also looking at people with intellectual disabilities. We have designed a small pilot in Bangladesh. Unfortunately, we wouldn't be able to sort of like have pilots in both the countries, but we want to take the learnings and apply to the other countries as well. That does not mean just because we are doing a pilot with people with intellectual disabilities that we are not reaching people with intellectual disability in Kenya. We are definitely doing, we will be doing that in Kenya, but it's just that the very specific focused pilot is happening in Bangladesh. And we also have a pilot that's looking at women and men with hearing impairment that's being conducted in Kenya. So within this larger sort of like, program, we have identified these 3 sort of like, small scale pilots where we could have additional interventions like addressing community level barriers, addressing family level sort of like, barriers that would affect these people from joining the labor market.
Thank you, Saku. We have more questions, but I'm just gonna take one, and I've been told I'm not supposed to say name of people who asked the question, so I'm sorry about that. So I won't say name, but then a question, and it's gonna be the last question because already we're gonna have to go to our next speaker, but if needed, we could also share the question with the speaker if needed. So the next question for you, Saku, is which government agencies are being considered in the implementation? And sorry, you did mention some of them already.
Yeah, did you say which implementing organizations?
Which government agencies
are
being considered in the implementation?
Yeah, so there are a couple of different ones that have been identified during the design phase, but that does not necessarily say that those would be the only ones. So the ones that we've identified definitely during the design phase are the Bangladesh Bureau of Statistics and similarly the Kenya Bureau of Statistics. Then the Ministry of Social Protection, and this could be in Bangladesh, the Department for Planning. I'm not exactly sure of the names. Then also the Ministry for Labor and the department sort of like, I think it's the National Employment Authority in Kenya. And then the National Council for Persons with Disability in Kenya. Those are some of the main sort of like, stakeholders we've identified. But as we sort of like, progress during the initial phases of sort of like, identifying who do we want to build skills for, this would most likely expand.
Thank you so much, Saku. So, Saku, we're going to leave it there. And again, if you feel you haven't got a chance, an answer to your question, we can always send them to our speakers. So I'm going to move on to Dr. Morgan Banks, but Saku, thank you again. Dr. Banks is an assistant professor with the International Center for Evidence in Disability at the London School of Hygiene and Tropical Medicine. So this is based in the UK. Her research focuses on disability, poverty, and social protection in low and middle income contexts. So today, Morgan will present the research findings on factors affecting access to wage employment amongst people with disability in Nairobi and Dhaka. So that research was conducted during what we call the co-creation phase of the i2i program. And that was to help us in guiding the activity in the implementation phase, which started this summer. So Morgan, the floor is yours.
Thank you very much, Marion, for the introduction. So as Marion mentioned, today I'm going to be looking at research findings on factors affecting access to wage employment amongst people with disabilities in Nairobi and Dhaka. And this research was conducted along with colleagues at the London School of Hygiene and Tropical Medicine, Dr. Shafa Hamid and Professor Tom Shakespeare, as well as colleagues at the University of Nairobi in Kenya and CRP in the Center for the Rehabilitation of the Paralyzed in Bangladesh. Next. So this research was conducted during the co-creation phase, and we conducted interviews with people with disabilities and key stakeholders in Dhaka and Nairobi to identify factors that affected access to wage employment, as well as existing policies and programs that supported the inclusion of people with disabilities in wage employment in both contexts. Next. Next. So we looked across the, one back. We looked at factors affecting people with disabilities across the entire employment cycle. So starting with education and training, going to job searching, and then finally their experience on the job. So we looked at factors affecting each individual stage, as well as cross-cutting issues that affected people with disabilities across this cycle, including accessibility and accommodations, attitudes and social norms, and additional costs. Next. Starting first with education and training, almost all of the people with disabilities that we interviewed had some formal education, ranging from a couple years of primary school all the way up to advanced degrees such as master's and bachelor's degrees. And almost all had attended at least one professional training course, either at an accredited institution in their area or a more informal training course hosted by a DPO or an NGO. In addition to their educational attainment, quality was a major factor that affected later employment for people with disabilities. So a major issue around quality was the lack of inclusion and accessibility of some of these education training courses. And this was a particular issue for people that required adaptive communication strategies, such as Braille or sign language. So even though people with disabilities or any specific impairments were enrolled in these courses, they may not have been getting the same skills as others in their courses without disabilities. Some of the trainings were also not well matched to the demands of the job market and the skills of the individual. Turning next to job searching, most of the respondents that we interviewed had sought jobs in a variety of sectors, including waged employment, and through different avenues. So through word of mouth, through DPOs, and through more traditional print and online advertisements. And families, DPOs, and other forms of informal networks were very critical for the job application process, particularly because much of the job application process was not accessible. However, this meant that people with disabilities were not able to apply for jobs independently in many cases. And there were several instances where, for example, family members might have expectations around what types of jobs the person with a disability could perform, in what sectors, and with what types of employers. So this could limit options for people with disabilities. And because of either the experienced or perceived barriers that people with disabilities faced when they were applying for jobs in the formal sector, many of them opted for self-employment or for working with DPOs instead of in waged employment. Next. Turning next to the experience of people with disabilities on the job, almost all the people that we interviewed in both Kenya and Bangladesh had some work experience, either in the formal sector, in self-employment, or in the informal sector. And most were employed at the time of the interview. However, for those that were working, the lack of accommodations in the workplace could affect their performance on the job as well as their satisfaction, which ultimately affected career progression as well as retention. There were also instances of discrimination, either by colleagues or by their employer, as well as segregation on the job. So, for example, there were people with hearing impairments in Bangladesh who were hired by an employer who had made concerted efforts to hire more people with disabilities. However, once hired, people with disabilities were in a separate workspace, had separate tasks, and they had fewer opportunities for advancement compared to their colleagues without disabilities. Next. So I've touched on some of these cross-cutting issues that affected people with disabilities across all stages of the employment cycle. One of the major ones was around poor accessibility and the lack of accommodations. So this could affect people during their training and education, when they were applying for jobs, and then even when they were placed at the jobs. In some particular areas where there was a need for accommodations was around adapted communications, so Braille, sign language, simplified instructions, in the built environment of schools, of office buildings, of application facilities. And a major one was around transport for getting to and from work or school. For people, particularly people with mental health impairments, there was also sometimes a need for flexibility in schedule or in types of tasks. Now, people with disabilities in some instances highlighted that their employer had provided them with accommodations, and that when these accommodations were provided, they were very beneficial and allowed people with disabilities to stay on at their job and to excel. However, when accommodations were not provided, this could lead to difficulties at work, and in some instances led to people leaving the waged employment in search of other forms of work or to not work at all. Next. Another cross-cutting issue was around attitudes and social norms. So discrimination was a persistent barrier, particularly when people with disabilities were seeking work, as employers either did not think a person with a disability could perform a job or could not perform it to the same level as a person without a disability. And these low expectations were held not only by employers, but also at times by family and by people with disabilities themselves. So this stopped people from going for certain opportunities, particularly in waged employment, or for going for further career advancement. And it's important to note that women with disabilities faced additional barriers due to gender norms around employment. And this was particularly true for women who were also mothers. Next. A final cross-cutting issue involved the additional costs of people with disabilities faced when going for work at the job, as well as during their education and training. So this included when people had to pay for certain accommodations that were not provided by the employer or educator. So some people paid to have textbooks translated to Braille or into audio formats, which could be expensive. People also spent a lot on transport, particularly in Kenya. People reported having to pay the matatu, the public vans, more money to take them to work because they had to stop for longer. People also had to pay for assistive devices and for health services that were essential for them to participate not just in work, but in society. And also people with disabilities spent a lot more time on certain activities because processes were inaccessible. So more time on applications because the process was not accessible, having to file more applications because employers were unwilling to hire a person with a disability, spending more time to get to work because transportation was inaccessible. Next. It is important to note, though, that in both contexts, there were programs that were available to support people with disabilities in accessing work. So in both settings, there were cash transfers. However, the amounts tended to be small. And in Kenya, people who were working were not eligible for this cash transfer. There were, however, in Kenya, individual income tax exemptions for people with disabilities working in the formal sector and earning below a certain income threshold. So there was an issue where people had to sometimes decide between going for a higher paying promotion or job and keeping this tax exemption benefit. There were also tax rebates offered to employers in the formal sector who hired a certain number of people with disabilities. However, the process for applying for these was quite complex and poorly understood in both settings. In Kenya, the National Council for Persons with Disability also provided subsidies or free assistive devices or education and training courses. There are also quota systems in both Kenya and Bangladesh for the public sector, with limited coverage in the private sector. However, in Kenya, the legal basis is quite weak for this, and so it was poorly enforced. And in Bangladesh, the quota was suspended at the time of data collection. Finally, in Kenya, there are job placement services where prospective employers can be matched with job seekers. There are disability targeted services as well as mainstream services. However, the disability targeted services had not been operational for the preceding several years. It is important to note that for people with disabilities to access any of these programs, they must be registered with the government as a person with a disability and have a disability card. And in both settings, very few people with disabilities nationally are registered, particularly people in rural settings. So this is an overview of some of the main findings. There is more information on the i2i website, including the full reports on both the policy environment as well as the research with people with disabilities on factors affecting their access to wage employment.
Thanks, Morgan. That was very interesting. And right away, you have a question. I mean, you just mentioned it, but maybe the question is actually, is the research report available and can it be shared with the audience? So do you prefer to have it sent to the participants, or is it better for them to go on your website, or how do you prefer that?
It can be sent, then that sounds great. I'm not sure if Rachel or Saku has the link. I could probably find it during the next presentation, though, if that's best to send it out through whatever I guess the chat board.
Well, what we're going to be doing, we're going to be sending a thank you note to all the participants today and add all the PowerPoint presentation, if it's okay with you, and any document that could be interesting for everybody. So we could add the research report.
Yes, we can definitely do that. It's publicly available now.
And so we've got a question mentioning, is the research more qualitative or quantitative based?
The research is qualitative, so it involved interviews with about 20 people with different disabilities, men and women, working, not working, in both of the two settings. And there were also interviews with stakeholders from government, from DPOs, from NGOs, about the policy context, as well as document reviews of existing research, which could be quantitative in both settings, as well as some of the guiding these different programs, but yes, predominantly qualitative.
Thanks. The next question is a lot of the findings are, in a sense, very familiar. So what has been standing out to you as very specific to the Bangladesh and Kenyan context in comparison with other countries?
So I agree that a lot of these are common issues that have been reported in other contexts, but yet we still see them time and time again. So I think there is that importance of still highlighting them and still addressing them. There were some differences between the two contexts. I think the role of family really emerged quite strongly in Bangladesh, that it didn't in quite the same way in Kenya, where family could be helpful for supporting people with disabilities in entering employment, but also very restrictive. And so I think that points to the need in the main intervention to engage not just with people with disabilities and their employers, but to look a bit beyond that at the community, but specifically the family, because that is a factor that I don't think is often considered in interventions from the past. And I think that there's some interesting bits around the policies in both contexts and ways that some of the lobbying through i2i can increase the utility of some of those programs. So for example, the income tax exemption in Kenya currently has a very harsh cutoff once someone reaches a certain income threshold. So people have to decide, do they want to keep that benefit or go for higher employment? So perhaps advocating for a more gradual decrease so that it's less of a hard decision for people with disabilities, as well as some of the clarity around the guidelines for employer rebates and for the quota system. So I think that there are little bits that are useful for the guiding the i2i intervention moving forward that are context specific.
Thank you. And the next question is, what does the research mean in prompting towards innovative solution that you feel should be taken up by the i2i program?
Okay, yeah, so I think some of those I covered a little bit in the response to the last question, but to highlight how some of the programs should definitely be targeted to better support people with disabilities entering waged employment, and also targeting the family as a source that can support people with disabilities, but can also sometimes hinder the inclusion of people with disabilities. And I think it's also important, so this research focused especially on waged employment. And I think particularly for waged employment, people feel that there are barriers. So they may still be working, they may be working for DPOs, they may be working for self-employment was quite common, but the particular barriers for waged employment, I think there was that additional hurdle in terms of the lack of accommodations and in terms of the mentality that people did not think that they would be successful either in getting those jobs or once on the job.
Thank you. The next question I think could be addressed to you, but could also be addressed to Albert or Saku, and it's the following. As there is another Site Savers-led consortium that is also implementing a project focusing on access to formal sector employment in Bangladesh and Kenya with similar implementation activities, how are the two consortia working together to ensure the efforts are not being duplicated and the maximum number of people with disabilities and DPOs are benefiting from both projects being active at once?
I think that's a good question. I might defer to Saku on that one.
Yeah, I'm happy to start and maybe sort of like, Albert might also be able to give more practical experience given that Access Bangladesh Foundation works across both the consortia. So the Site Savers-led consortium and the Leonard Cheshire-led consortium, we do meet on a monthly basis in terms of being able to mainly discuss some of the areas where we think there is a high risk for duplication and how we might be able to work in a way that is complementary. So we've had quite a few of those discussions, and we've looked at, in terms of the private sector, we definitely are looking to not necessarily overlap, because what we are hearing from the ground from both countries is that there is enough companies for both the consortia to reach. So that's something that we are working on. But at the same time, there are there are sort of like, interventions where it would also benefit for us to work together. So for example, the Innovation to Inclusion Consortium will be working with the National Business and Disability Network. And we also see a role with the Inclusion Works Consortium, where any companies that is reached through their program could also be part of the Business and Disability Network that would strengthen their membership and the work that they do. With the disabled people's organizations, that's another sort of a conversation that we've had to see how could we ensure that we reach a larger number and we don't duplicate. Now, what might be a bit difficult for us there is because both programs are looking at advocacy, sort of strengthening the advocacy components with disabled people's organizations, and we will need to work with organizations at a more national level. So we are trying to see that how could we do it in such a way that we don't overwhelm the organization. So we might have like, combined training, or also sort of like, looking at how can we support DPOs to strengthen their capacity around safeguarding and security measures. In terms of the number of persons with disability, that's where we don't see sort of like, a huge overlap, because we are sort of like, I think both the consortia have quite sort of different approaches in terms of like, the employment pathway that they want to take through. So we think, the project should be able, both the projects should be able to reach different people with disabilities. I think geographically there are some overlapping areas, but there's also areas where like, we'll be working in different settings within Bangladesh and Kenya. That's from a very sort of like, global perspective, but Access Bangladesh Foundation, given that they work across both the consortia, might also have other areas that they want to input into.
Saku, thank you for your answer. Actually, because of time, we're gonna have to go to Albert and his presentation. So I'm very delighted to welcome Albert Mollah today as our final speaker. Albert Mollah is the co-founder and executive director of Access Bangladesh Foundation. He has over 18 years of experience in disability development, particularly in skill and employment of persons with disability. And recently he has been awarded as an Ashoka Fellow for his outstanding contribution to the disability field. So Albert, you're going to be talking today about the challenges and opportunity in achieving SDG 1, so the Sustainable Development Goal on poverty, and when it comes to people with disabilities in Bangladesh. So again, if you have any question, you can just add them in the chat box, and I will take them at the end of Albert's presentation. Thank you, Albert. This floor is yours.
Yeah. Thank you, Marion, for introducing me, and thank you very much for inviting me in your first webinar. So I'm going to talk about the challenges and opportunities in achieving SDG 1 and poverty, particularly for persons with disabilities in Bangladesh. Next. So I'm going to highlight some background, Bangladesh government initiative to facilitate implementation of SDG 1, major challenges to achieve SDG goal 1, and opportunities. Next. So I will talk about very briefly in the background slide. Maybe you are aware that Bangladesh is one of the densely populated countries of the world with around 164.6 million people. And we know that the poverty and disability go hand in hand, forming a vicious cycle. And there is a cost implication if you exclude persons with disabilities from the development agenda. And according to the World Bank study, cost of exclusion of persons with disabilities in Bangladesh is 1.7% of the GDP. Allocation in the safety net is 14.21% of the total budget, and disability allocation belongs only in this safety net area. Disability allocation is only 2.1% of the safety net. That is, if you calculate on the total budget, it will be 0.21%. Bangladesh government assessed that an additional amount of US dollar 928.48 billion would require for achieving SDG in Bangladesh, which is annually average cost US dollar 66.32 billion. Next. Bangladesh government took some initiative to facilitate implementation of SDG 1. Number of social protection schemes 32 as per recent financial year 2019 and 20, and among them the disability specific schemes are 11 and broadly in 4 categories: cash transfer, food security, microcredit and development sector. 5% rebate of total tax if the taxpayer employer recruits at least 10% employees with disabilities. 1.54 million persons with disabilities will receive disability allowance per month if we calculate 7.15 pound each person. Stipend for 100,000 students with disabilities, and again in different level, primary, secondary and higher secondary. Next. There is a job quota in the government job, 1% for first and second grade job, 10% for third and fourth grade job, which includes orphans. And there is another benefit, 5% reserve quota for students with disabilities in all technical vocational education and training institute. Persons with disabilities do not need to pay taxes if their income up to level 3,810 £10. Corporate organizations can make allowable medical expenses up to Taka 9,524 pound for an employee with disabilities, while generally the limit for the average employee is 5,524 pound. Corporate organization perquisite limit for an employee with disabilities is 23,810 pound. This means actually this amount will be deducted from the income of an assessee. Next, please. For companies, the donation they make for people with disabilities is considered for tax rebate under corporate social responsibility, and the rate of tax rebate is 10% of such contribution. Government job holders, children with disabilities, maximum two children will get the pension after their death. Imposition of 5% additional tax on a medical service provider, institutes, college, university, and NGO who fails to ensure accessibility for persons with disabilities. And the government operates a specific microfinance schemes for persons with disabilities, that is very reasonable, very minimum service charge, that is 5%. Next. And now I am going to highlight some challenges to achieve the SDG goal 1. You see that the disability data which is available now in Bangladesh is confusing, as the different agencies they use different methodology in collecting data. So if you see the figure, 9.07% according to the Household Income and Expenditure Survey 2010, and HIES 2016 6.94%, Census 2011 1.41%, and Disability Information Systems till August 2019 1.68%. So you see that different agency and different study show different figure. So if you see that, out of total 241 indicators of the SDG, data of only 70 indicators are readily available, 108 are partially available, and 63 are not available. And if you see the poverty indicators, out of total 12 indicators, readily available 5, partially available 6, and not available 1. So still there are majority of the indicators are data are not available in Bangladesh. Next. So due to unavailability of disability data, actually it is a challenge for the country. It's a big challenge for the country for planning as well as monitoring progress on the SDG implementation. And if we see the country's 7th 5-year plan, there is a major challenges area where the absence of specific indicators on disability in the development result framework. So you will see that there are 15 priorities set in the development result framework. Only education, other 14 areas are absent in setting indicators. So it's a really challenge for implementing the SDG goal 1 in a particular time frame. There is no system of maintaining disaggregated social protection data by gender and disability. You see there are many social protection schemes, but they are not maintaining disaggregated data. So next please. And another challenge is insufficient allocation in the social protection scheme, particularly for persons with disabilities. I already mentioned earlier that there are many social safety net schemes, but disability allocation only 0.21% of the total budget, and particularly if we calculate in the safety net, it is 2.19%. Inclusive social protection policy and programs are not yet developed. There are many social protection schemes, but these schemes are not inclusive for persons with disabilities. And in our country, that extreme poverty rate dropped to 12.9% in 2016 from 44.2% in the 1991. But there is no study on how persons with disabilities have been addressed in this situation. Next. Lack of coordination is another challenges. There are different ministries, they are doing different work, but there is a gaps of coordination. And if we see that in our country that only 89% children with disabilities are not enrolled in the schools, though literacy rate is 73.2%. Due to unawareness, stigma, discrimination, inaccessibility, persons with disabilities are less access to skills and employment. And if you see the general health system, this is also not inclusive of persons with disabilities. Next. Now I will tell about some opportunities. We have a lot of challenges, but we have also opportunities. In our country, Bangladesh, we have a strong legal framework. We have different specific policies, rights and protection of persons with disabilities, 2013 National Disability Plan on Disability, which recently in January 2019 passed by the government, National Education Policy 2010, National Skill Development Policy 2011, National Strategy for Inclusion of Persons with Disabilities in Skill Development. All these policies actually will support to implement skills and employment in Bangladesh. And also there is a strong commitment of the government. In fact, the head of the government, he has a good intention, particularly for the development of persons with disabilities. Their election manifesto included the disability issue, and already the government signed the UNCRPD, also ratified the optional protocol, and they also endorsed the SDG, and also we have the 7th 5-year plan. So all these things is a good sign, for achieving the SDG. Next. Allocation is increasingly, gradually increasing in the social protection scheme. As I mentioned that there is a good number of safety net program, 132, and we have 103 disability support and service center in the countrywide. They are in operation and they are providing different specific support for the persons with disabilities. And Bangladesh has a rich experience in administering microcredit program. So it was all in my presentation. Now I think the floor is open for questions.
Thank you, Albert. That was really interesting. And we have some questions. We're not going to be able to take them all. And I'm going to start right away with the following. In line with Article 32 of the CRPD, so article focusing on international cooperation, and from advocacy for inclusive employment, so Article 27, how are governments and DFID funded program reinforcing the inclusion of persons with disability in other interventions?
Very good questions, actually. You know, the international cooperation and Article 27, work for employment, and particularly the innovation to inclusion program will focus on formal employment generation of persons with disabilities, including women with disabilities. So, you know, that recently I can say that the innovation to inclusion program or inclusion works program, these are the first time, you know, such a comprehensive project implementing in Bangladesh. So from the international cooperation, different agencies are coming and they are providing support in the disability field. And definitely Article 27, and I mentioned that in our country law 2013, also in line with the UNCRPD. So we are hopeful that within the project period, we will see very positive changes in Bangladesh, which will encourage other development agencies, you know, to replicate in other area.
Thank you, Albert. And the next question is, what are the common challenges and opportunities in achieving SDG 1 in Bangladesh that needs to be explored more in depth?
Okay.
So maybe related to data or initiatives.
Yeah. So I mentioned in my presentation very briefly the challenges and opportunities, you know, and categorically I have mentioned in my presentation the specific, you know, initiatives which Bangladesh government already initiated. So the specific, if I say the challenges, you can see that, you know, the law, we have a strong legal framework, both domestics and international, but these laws and policies are not being implemented. From the implementation point of view, there is a lackings, you know, and also that coordination among the different ministries, also a challenge for our country, you know, and the challenges, you know, in our private sector, the main objective of i2i to generate employment in the private sector. So the private sectors, you know, the majority of the employers, they are not quite ready to take persons with disabilities. A lot of, you know, a lot of work we need to do to you know, to motivate them, to educate them. So, and then opportunities also, you know, there are opportunities also, you know, the main opportunities, you know, if we see that the head of the government is very positive towards the persons with disabilities. So I think these challenges and opportunities, if we work to minimize the challenges and to work for getting benefit from the opportunities, I think we will be in a good position to create a inclusive practice in the employment generation sector.
Albert, I'm going to ask you a last question because I'm conscious of the time, but it's related to the mechanism available. So the question is, what are the mechanisms available to monitor the schemes that are meant for people with disability and how people with disability are included in this monitoring process? And I think the second part of the question is actually really interesting.
Okay. So it's a good question, you know. And again, I mentioned that, you know, there is a data gap. You know, the government, they also did a data gap analysis, and from the data gap analysis, they found there's a lot of data, you know, which are not available. So how the monitoring will be happen? This is really a challenge in our country. So, and also, you know, the monitoring aspect is very poor in this country. So what we are doing, you know, that the innovation to inclusion program, they engage many actors, particularly the persons with disabilities organization DPOs in Bangladesh. So I think through DPOs engagement, a strong monitoring system will be developed through this project, and I think all the actors, as there is a weaknesses in particular monitoring aspect. So the different actors will think how they can work in developing strong monitoring system in Bangladesh.
Thanks, Albert. I'm sorry, that's all the time we have for today, but that's been really, really interesting. I really want to thank you all three, Saku, Morgan, and Albert, for taking the time to speak to us, and also to all the participants who took the time, an hour of that time, to come and participate in the webinar. So we're going to stop here today. I just want to also thank our colleagues at EDF working on organizing the webinar, and the captioner and the sign language interpreter. I mentioned it earlier, so what we will do, we will send you a PowerPoint presentation, we'll send you an email with the PowerPoint presentation, the report Morgan presented, and the summary of the webinar, and any other information we think is relevant for all the participants. And then we will organize another webinar in December. It's going to be focusing on Article 27 and 28 of the CRPD. So again, employment and social protection. We have to go through the details a little bit, so I'm not going to talk more about it. But I want to thank everybody again, and I wish you a wonderful day or a wonderful evening wherever you are based. Thank you. Bye-bye.